Mrs. Ratua, the Mayor of Catabon, and if you had allowed me to say just, dear colleagues, good afternoon. Firstly, believe me, it's a pleasure. It's a pleasure for me to participate in this 3 days workshop on pediatric cardiology organized by the Cardiovascular Society of Mauritius. You know, when I came here, when I got the invitation, I thought I was going to talk to mainly pediatricians, but I'm afraid I don't see many pediatricians here today. Being a pediatrician, I thought there'll be a lot of pediatricians, but I'm afraid I don't see a lot of them. But anyway, I like to take the opportunity to congratulate the Cardiovascular Society of Mauritius for organizing this first symposium on pediatric cardiology. And I also have a special thank you to Dr. and Mrs. Sangeeta Viswanathan from India for having spared her valuable time to come and share her knowledge with our colleagues here in this super specialized field of pediatric cardiology. I remember I first became interested in this subject, that is pediatric cardiology, after a stint at the Children's Hospital in Liverpool, Myrtle Street at that time, during my pediatric training in UK. When I came to Mauritius in 1982, a long time ago, together with the same cohort as Dr. Benoiri, we joined the service together in 82. Things were very difficult. I won't say a bit difficult, it was very difficult at the time. At that time, personally, I used to see a lot of acute rheumatic fever with the whole spectrum, carditis, arthritis, chorea, you name it. But gradually over the years, with the improving condition, these acute cases gradually disappeared. And now our burden is mainly congenital heart disease. Here, if you allow me, on this very first workshop on pediatric cardiology, allow me, it's very important because it's the first meeting on pediatric cardiology, and I can't help but remembering some of my colleagues, those doctors, and I would like to pay special tribute. I take this opportunity to pay a special tribute to all these doctors who work to look after children with cardiac disease in the past. Here I'm thinking Rashid Bibijan, Santosh Kalachan, Ribai, Amrit Rajkumar, Dr. Mohamed Bai, Dr. Vincent Benoiri, and other colleagues in the room. Because for me, it's very important to remember these people who work when it was very difficult. 35 years ago, when we didn't have that much facilities. That's why I took this opportunity, with your permission, to pay a special tribute to these people who work in this difficult time. And I must not forget, when we had difficult cases in pediatric cardiology, we had the organization SAKIM, who did a lot for children with cardiac problem at this time, and they're still working, they're still very active. They work hard at that time to provide this service for our little cardiac patient. And yes, I must not forget the different cardiac team that came from overseas to give us a much needed helping hand at that time as well. We still get a lot of people coming from overseas, just like today. Dr. Sangeeta is with us here today. But it's very important we get this kind of help, because Mauritius, a small country with a small population, we don't have that manpower for some super specialty. That's why we need to get the help. And we have been having it over the years, and I would like to thank again Dr. Sangeeta for her presence here today. I just mentioned just a few words about years ago. Things are now changing. It's different now. facilities are improving. Okay, I agree. There, we still have a lot to improve in subject like pediatric cardiology. I agree, but things are moving in the right direction. As you are aware, we have decentralized a cardiac surgery service from SSRNH to Victoria Hospital about a month ago. With your help, I'm sure we can reorganize a pediatric cardiology service in Mauritius as well. All the pediatric cardiology cases are referred to the cardiac center for assessment. It's very important that we have an up-to-date statistics on these cases. If you are going to cater for these children, for me it's very important, because if you don't have the figures, if you don't have proper statistics, you can't plan properly. It's very important that we have proper statistics and we update our register on pediatric cardiology problem. Once we have this a good register, an updated register, we can reorganize the service in terms of infrastructure, investigation, proper training for our staff, as has mentioned by the colleague before, and obviously the treatment of these cases. Last year, with the help of the overseas team, 25 interventional cases were performed locally. 19 cases were operated here as well, and 6 complex cases were referred overseas. This year, 11 pediatric cardiac surgery were done at the cardiac center by the visiting professor, Dr. Salvatore Agati. In November this year, we are expecting the visit of Dr. Polymenakos from a children's hospital in Georgia, USA, who plan to do about 15 to 20 complicated pediatric cases as well. We have a team of cardiologists and cardiac surgeons from Healing Little Hearts Foundation in UK, who will be coming in December this year to carry out interventional case on a patient. Furthermore, in the coming year, we are planning to sign an MOU with a pediatric cardiology center in Taormina, Vatican City, Italy, headed by Dr. Salvatore Agati, so that we can continue to provide this kind of complex surgery here in Mauritius, or if we can't, overseas, yes, but at least we can provide them here as well. Because pediatric cardiology can be very complicated. Congenital cardiology, I don't have to tell you, you know better than I do, they are very complicated cases. That's why we need people who are very kind of well trained in this surgery. And if we can get their help to come and operate here, we'll welcome that. It's good for the patient, it's good for the family when the child is being operated here in Mauritius. But if we can't have it here, obviously, we'll have to send the child overseas. We'll do that. As I mentioned before, Mauritius will have a limited population. And at present, we don't have the means to develop such highly super specialized field. That's why we have been doing that for the years and until today. Such international collaboration in teaching, sharing of expertise, research and treatment. Ladies and gentlemen, I don't want to take a lot of your time. I know you have 3 full days of hard work. I've seen the program, very complicated, packed full of differentiation. Believe me, having gone through that program, as a pediatrician, I wish I could have been here for the next 3 days, but obviously I can't make it because of my time constraint. Anyway, before I end, I would like to appeal again to all of you, pediatricians and cardiologists. We have to improve the care of these children. We can do better than that. We are improving, just as we are improving the specialized pediatric care, neonatal care. We are doing the cancer hospital, obviously including the pediatric oncology. We are trying to improve that as well. We are opening the Center for Pediatric Blood Disorders at GNH. It's high time to develop and improve pediatric cardiology here in Mauritius. And for me, hence the importance of this meeting here today. Well, ladies and gentlemen, dear colleagues, With these few words, I wish you a fruitful discussion and deliberation over the next 3 days. With your permission, I have the pleasure to declare the symposium open. Thank you very much for your attention.